Good afternoon, everybody, and thanks to my colleagues in the panel for such a great introduction to the costing issue. I am glad to present you an experience that UNICEF Western Central Africa Regional Office is piloting in 10 countries in the Western Central Africa region, which covers 24 countries. Just before I start, you are aware probably of the conditions of the majority of the countries in this region. Countries are affected by conflict, like Mali, Central African Republic, epidemics, the Ebola outbreak is everywhere in the news, malnutrition. Young children are living in these conditions in the majority of the countries, and when we advocate for early childhood development and finance for early childhood development, we need to take into account that conflicting priorities are on the government agenda for health, for nutrition, for infrastructures. And our attempt with this program was to, as Caroline said before, to create local evidence to have a stronger message for our national counterparts. Global evidence on ECD is great nowadays, where it's not enough for countries that have so many priorities to deal with. So we need to engage the national counterparts and the partners and the civil society in creating this evidence. I have so many indicators that I could share with you, or evidence on the conditions of children once more, but the one that I chose is the one on school readiness in Western Central Africa region. Preschool education is still an option. I don't know if you can see the figures, but the average is 24.5% of children having access to preschool education. Out of these 24.5, I would say that 80 to 90% live in urban areas and comes from very wealthy families, I would say. So inequities is again one of the major characteristics of the countries in the region. 24.5 is not representative at all of the majority of these countries. You will see countries like Chad or Mali that have only 2 or 3% access to preschool. So this is the conditions in terms of preschool education, but one of the major issues is, of course, malnutrition as well in majority of these countries, and we know the links of malnutrition with child development. So just keep this in mind to understand the context we are trying to work in. So preschool education is still an option, which means that young children most of the times are not on the top of the agenda. The program aims at rolling out 3 types of tools in 10 countries for measuring parental behavior, early learning outcomes, and feeding then costing model in those countries. I would say that there is a good dynamics going on in majority of these countries where the national counterparts comes to organizations like UNICEF or other partners, the World Bank, for example, the GP, and ask for support in costing, ask for support in making early childhood services a reality. But if they have in mind the targets, they don't know how much it costs, and they don't know how they can include the issues related to quality, for example, or customize the service to the conditions of the country. So the parental behavior survey is the first of the tools, aims at measuring and assessing the quality of the interactions caregiver and children, looking at, for example, the availability of time for mothers and caregivers to spend with their children and to interact with the children. This is something we are not used to cost. This is something we are not used to look at. But if the mothers have no time to spend with their children, there is no interaction going on. The parental behavior survey also look at social and cultural norms. Some of the mothers, for example, interviewed in Mauritania through these surveys, admitted that they didn't talk to their children as long as their children were toddlers or up to 3 years old, because children couldn't talk to them. So there was no point in discussing or talking to the children. Now we know that in some of these countries, majority of these countries, there are a lot of potential beneficial practices in terms of stimulation and of course interaction. But some of these points that comes out from the parental behavior survey can help shaping parental education programs better and then define the costs for these design. The second tool is the early learning assessment, which is the tool I'm most passionate about because it's really helping us in some of these countries coming up with the information about the actual impact of outputs and supply and demand on child outcomes. This assessment is done on children entering primary school the first 2 weeks and is building a sample with children that have been to preschool or not have been to preschool. The first information, of course, is no news, is that those that have been to preschool are far more prepared to enter primary, but this is big news for the countries that are doing this because, again, it's contextualized. I want to bring you directly to this, which is one of the most important findings that we got through the early learning assessment, which is the fact that the research, the tools is showing us that 2 years of preschool actually give us 90% of the outcomes required to start primary. 1 year almost give us 60%. This is the case of Togo, where we did the assessment. This kind of information, contextualized to the countries where we are working as, has huge implication for costing and can make sure that at least 1 year or 2 years of preschool are included in the national budget, with a lot of evidence on the school readiness and preparation of children to school. Other information that are coming up from the early learning assessment and that really fits the costing model is the fact that some of these countries don't need high-level university teachers for preschool, but can have very good can contribute to very good children outcomes with very specific and short-term trainings for community teachers, for example, enabling these teachers to deal with the actual organization of the day with toddlers. Other information that are coming up concern the size of the classrooms, the infrastructures. We are trying to cross all these indicators, all these elements with the actual outcomes of children once they enter primary. And this, again, has huge implications for the costing and the budget. Quickly, what we are trying to do is, of course, the costing model itself is not a new costing model. If you are comfortable with the education sort of costing model, this is what we do with the countries. What's new here is that we try to feed the costing model with this new evidence and the process of creating this evidence, which is very much participatory and done at the national level with the Institutes of Statistics, with the preschool education sector and other civil society. As I said, these are just some of the points that comes out from the tools and that we are trying to measure and cost. And I want to finish with a positive perspective, which is that there is a great opportunity for community-based options in countries in West and Central Africa. So far, we knew that they were the less expensive. We didn't know that they are quality. And what's coming up from the early learning assessment is that the potential for school readiness is very, very high in community-based options. So indeed, there is to solve out the problem of decentralization and governance, as Pia mentioned before, but we have evidence that this can be one of the solutions to respond to the lack of access and offer of preschool, for example. So much to say more on parental education. I can say it more, but I will answer your questions with pleasure. Thank you for your attention.